what's going on, everyone? You are currently tuned into the Better Today, Healthier Tomorrow podcast. I'm your host, Ryan Howard. Today, we'll be getting an opportunity to chat with one of our athletic trainers, Cody Walker, and we'll be discussing how to get ready for summer sports season, from sports physicals and coach training to keeping athletes safe on and off the field. Cody, how you doing today?
I'm doing good, man. How are you?
Oh, good, man. Can't complain. I don't want to waste any time. I want to get right into everything. So first, for the people at home, can you briefly describe what your role kind of entails here at the hospital?
Thanks for the opportunity, man. I'm always happy to sit down and talk about how to keep athletes safe. So I'm the Supervisor of Sports Medicine here, Arkansas Children's Hospital. So I manage all of our outreach athletic trainers that go out to our local high schools here in Little Rock, some of them down in Pine Bluff, Jacksonville, and Lone Oak. And our athletic trainers take care of kids. They watch practices. They focus on injury prevention stuff, which we'll talk a little bit about. And then they evaluate and help treat any injuries that happen. And then if there is an emergency situation, they kind of help facilitate getting that kid taken care of, getting them to the hospital.
Oh, man, that's awesome. I think that's so cool that they have you guys out there at the games and everything. I'm sure that probably makes the athletes and the parents and everything feel a lot safer knowing that you guys are there kind of keeping an eye on everything. So kind of just shifting gears and kind of getting to the topic a little bit today. So we know that the summer is coming up, and not just a regular summer. I feel like Arkansas summers are a little different from summer everywhere else. So I know that can have a huge impact on athletes, especially with them out training and participating in summer sports. So I guess I want to ask you, like, why is it important to start thinking about summer sports preparation like early?
We always worry about the heat, right? That's probably top of mind as it starts to get hot. We know that kids are pretty vulnerable to the heat, especially this time of year when it's been in the 70s and then all of a sudden it just jumps up into the upper 80s and mid 90s. And these kids are going to start being outside more. They're going to start practicing football with pads on and helmets on. And so we want to make sure that they're taking time to adjust to that heat. And so there's a couple of different ways they could do that. They can slowly progress how long they're practicing each day. The AAA, or the Athletic Activities Association here in Arkansas, actually recommends and requires that kids start out, if they're practicing football in the summer, they start out helmets only, and then they progress to helmets and pads, and then they progress to full pads. And that takes a full week process for them to do that. And so those are some methods that we use to kind of get those kids ready to start participating in the heat.
I think that's so cool that you guys actually have like practical steps that like parents and coaches can implement to make sure that their kids are safe while they're out there doing their thing on the field. So I guess taking this and bridging this into like the preparation piece with the safety. So I know that there's a lot of other common injuries that like student athletes can kind of run into. Is there any, like, I know you've lined out what parents and coaches can do to kind of protect themselves against the heat, but for those more common injuries, are there any things, preventative measures that parents and coaches can take to try to safeguard their kids while they're out there on the field?
When we're talking about injuries in athletics, some of the more urgent, immediate issues that we see are what we call the 3 H's. And so heart, heat, and head are kind of the top 3 that cause that can cause sudden death in athletics, right? And that's always the big scary things that we worry about. We saw a couple years ago, Damar Hamlin kind of opened a lot of people's eyes to that this can happen to anybody. And so heart issues are the number one killer of young athletes. I think the scariest thing about that is a lot of times kids don't even know they have a heart condition. And the first time that they have a signs and symptoms of a heart issue is when they have a cardiac event at practice or in a game or whatever. And so, and then you've got heat, which we just discussed, and then you've got head injuries. So things like concussions, traumatic brain bleeds. And so we can, a lot of things we can do to prevent those is one, making sure we have proper what we call pre-participation exams or a sports physical. A lot of times we can catch some of these issues before they happen, right? We ask questions about family history, chest pain during activity, family history of sudden death. A lot of those can kind of help pick up if a kid's at risk. And then second is just making sure that we're properly educating our coaches, our parents, and our student athletes that these are real risks that can happen in sports. And then helping them to kind of identify the warning signs of it. And then if an event occurs, what to do during that event. We always say, we always think of like athletic trainers and like paramedics as like being the first responders to an event. But really a coach is can be the first responder, right? They're the ones that are with the athletes all the time. And they are able to, everybody could save a life. We talk about that a lot. A lot of what we do is that coaching education aspect and trying to empower the coaches to be able to respond to the situations until an athletic trainer or a paramedic can get there to kind of take over the scene.
I don't think I can stress enough how cool it is that you guys have these preventative measures and things in place that people can kind of implement to be proactive to prevent these injuries. But, I think something like a lot of times with these injuries, even though if you can prepare for everything, it's like Murphy's Law. If something can go wrong, it goes wrong. So, like, what kind of things can parents and coaches kind of keep an eye for, like during the games or practices, to like be able to identify something isn't right with this athlete, something's going on with this athlete potentially before like they experience like an injury with heat or heart? Are there like signs and things that they can keep an eye out for?
Yeah, definitely. And you're right, things do happen, right? Most sports are incredibly safe for students to participate in, and a lot of kids will be able to participate and never have an issue. But the incident of sudden cardiac arrest in student athletes is somewhere around 1 to 2 per 100,000 athletes. And so, maybe a smaller number, but still they do happen, right? To kind of put that in perspective, there's about 100,000 kids that participate in athletics in Arkansas. And so if you look at that number, 1 to 2 per year could have a cardiac event. We've had some student athletes in some of the schools that we work with that have had cardiac events during competition. One most recent as a couple of years ago, a perfectly healthy kid playing basketball in a competition, shot a 3-point, made it, turned around, and then he just dropped down. Luckily for them, the coaches had undergone something called Project Adam training, which I think y'all have talked with Charles Woolley before on some of his podcasts. They were able to implement early CPR and getting an AED on that kid. And because of that, he's alive today. Not only is he alive, but he is back to participating in sports. And so like, that's a cool story of just anybody could save a life. It was coaches and an official at that game that kept that kid alive long enough for the medics to get there. And so some warning signs that we want to look out for, if kids are having chest pain, shortness of breath, maybe struggling more than normal with activities that used to be easier for them, probably got to pull them from competition and follow up with their primary care provider, getting them seen, getting their heart checked. As far as heat goes, making sure that kids are drinking water. And then if kids are, we call it altered mental state. So maybe they're acting different than normal. We got to get those kids cooled off. The first step is getting them inside, getting any equipment off, getting some cold towels and ice on them. If they're not making rapid improvement, then we actually put them in a tub of cold water with ice. We call it cold water immersion. And yeah, so it's kind of some techniques there.
Yeah, that's awesome. And I guess circling back around, when we were talking about like preventative measures, you mentioned physicals. For the people at home, can you kind of explain what exactly a sports physical is and why it's required for student athletes?
a sports physical or a pre-participation exam evaluation. They're the same thing. Basically, it is a time that you sit down with a medical provider, be it a doctor, advanced practice nurse, and you discuss kind of your past medical history. So we look at how that athlete's responding to activities. So do you have shortness of breath when you participate? Do you have asthma? Do you struggle with certain things? And then we ask family history. So, do you have a history of sudden death in your family, history of cancers, history of, genetic disorders, things like that. And then they go through an exam. That exam usually consists of something we call a musculoskeletal screening. So we have them do all these funny movements, duck walks and jump in on one leg, and we have them reach up high to the sky and bend down and touch their toes. We see if that causes any pain. And then we have them see the physician, and they'll listen to their heart, they'll listen to their lungs, and then they'll ask them many, follow-up questions. And so really what that's doing is we're trying to figure out if they have a genetic disposition to these issues. And then we're listening for things like murmurs or weird heart sounds, maybe lungs that are not feeling like normal. It could be a sign of asthma, stuff like that. And then just trying to make sure that they're ready for participation. The American Academy of Pediatrics recommends that takes place annually. In Arkansas, sports physicals are good for up to 15 months. And so every kid has to get a new one every year if they want to participate. That 15-month period allows them a little leeway to get in with their primary care provider or whatever. And then the American Academies of Pediatrics recommends that physical take place no later than 6 weeks before participation. That way it kind of gives you some time. If they hear something funny with the heart, we can get you followed up with cardiology, get you checked out, make sure that everything's good to go before you get out there on the field.
Can families get these physicals done through Arkansas Children's? Is that something they can get done with their primary care doctor?
So we always like to recommend that they follow up with their primary care provider. It's good to have an established primary care provider because there's what we call continuity of care. And so we want those kids to get established with a PCP. And so that definitely is possible with our primary care clinics here at Arkansas Children's. And then, there's a ton of other pediatric clinics in Little Rock in Arkansas, just getting them connected with somebody that can manage their care. Cause some of these kids do have things like asthma, maybe they have some musculoskeletal issues that they need to have managed, or they have diabetes, things that, you want a provider to see kind of ongoing instead of just once. With that being said, there are other options. There's always access to care that we want to be cautious of. And so you have your like mass physicals. Some facilities will do mass physicals when they come out to the schools and do those things. And then you have your urgent care options where you just go see an urgent care. But by far the recommendation is that we want those kids to follow up with an established primary care provider. And we definitely have that option here at Arkansas Children's.
Oh man, that's awesome. So I want to shift gears just a little bit.
Mm-hmm.
A moment ago, you said that anybody can save a life,
Yep.
right? And I feel like Arkansas Children's is doing a few things to make that more true than ever. Because I understand you guys are actually doing a training now.
Yeah.
For the guys at home that didn't know this, I guess we're doing like a bit of a training where they're training coaches and training like some of the staff or like people that don't necessarily work in medical backgrounds, but they're doing trainings where they can like help those students. Can you kind of talk about what you guys are doing right now?
Yeah. So we do a annual training every year with the coaches from the Little Rock School District. And so that training, there's somewhere between 100 to 150 coaches will show up to it. And then the Arkansas Athletic Activities Association requires that every coach, volunteer or certified coach, on staff in the secondary school setting undergo training in concussion, heat illness, sudden cardiac arrest, communicable diseases, which is like skin disorders. Uh, and that training has to be done every 3 years. Okay, so they had to have that on file every 3 years. We do it with the Little Rock School District every year. So those coaches show up every year, and my staff and me lead our coaches through recognition of sudden cardiac arrest and heat illness, concussion, treatments for that, and then kind of some background history on making it specific to their school. And we do that. And then we've also partnered with Charles Woolley here with the Heart Institute doing Project Atom. And so Project Atom is a fantastic resource where he is actually going out to these schools and creating what's called a cardiac emergency response plan, which is now a state law. Every school is required to have one on file. And so that teaches the admin and the teachers how to respond to cardiac events. And he's been working with us to get a lot of coaches involved in that. And so that basically just gets coaches certified in CPR, gets coaches aware of how to use an AED or a external defibrillator, and to know where those things are so that they can respond to events when they do happen. So yeah.
All right. And I guess so in your opinion, like I know that athletic training, all this, it affects like the community at large, but how do you think that all this work kind of benefits the broader community?
Yeah, great question. So I think that, our athletic trainers have a unique role in medical care. So when you think about your doctor, right, you probably see your doctor once a year. And so you may only see your medical provider once, 2-3 times a year, or when you need them to. And it's usually a one day, you see them for an hour or something like that. The benefit that athletic trainers have is they are with their athletes all the time. On a daily basis, they are with their athletes at practice. And so they get to build a lot of relationships with the athletes. They get to build a lot of relationship with the coaching staff, with the admin at the schools, and with the parents. Because, when a kid gets hurt, they reach out to the parents. They kind of talk, educate the parents, and they kind of walk through that injury with the athlete and the parent. I liken it to being a trail guide. They kind of guide them through the injury process. If they need to come to the hospital, they kind of help set that up and kind of guide them through the recovery aspect. And so they have this huge community piece where they're out there, they're helping reduce healthcare costs, both to the parent, to the school district, by helping try to prevent some of these injuries. And then when they do get injured, we kind of expedite that care so that somebody's not sitting in the emergency room for 8 hours waiting to be seen. If we know that they need to be seen, we kind of help facilitate getting them into our specialists and getting them kind of set up with definitive care. And so they have this huge community aspect.
All right, that's awesome. So not to tell a bad sports joke, but I think I'm gonna call an audible real fast. That was terrible. Yeah. But something that I think, or something that I like to do in interviews, because I think it's so important for the people at home to kind of like get an understanding of how great our staff is and really get an understanding of who's actually working here.
Yeah.
So asking you something personally, like why did you decide to get into this particular profession?
Yeah. Good question. You didn't prep me on this one, so this will be off the cusp here. So I knew from an early age that I wanted to go into some kind of medical field. That has always drawn me. The like the science behind it, I've always been really interested in. But I've always been very interested in helping people. And I knew that was one way that I could help people. And I didn't quite know what I wanted to do. For a little bit, I was going to be a nurse, then I was going to go to med school. I didn't quite know. And when I was in high school, I ran cross country. And I had really bad shin splints one time, and I got to meet our athletic trainer that worked at the school at the time, and she took really good care of me. And I was like, man, this is cool. She gets to be involved in sports, but she also gets to be involved in the medical side. And I love sports. I love watching sports. I love being around sports. And so that kind of allowed me to do the medical stuff and also be involved in the sports and still get to help kids out. And there's nothing more rewarding than seeing a kid at a low point because he's hurt, he can't play, and helping him get back to something that he loves to do. There's nothing more rewarding and exciting to see them at.
All right. And last question. I feel like I always ask this selfishly, but we know that like this type of work, like I know for me just sitting and chatting with you a second ago, I know this work can be pretty difficult, even for the athletic trainers. Like you're pairing up with a team. It can be demanding in terms of your schedule because you have to be at every single game. A lot of times you're at practices. So I guess if you had to speak on behalf of yourself and your team, what is you guys' why? What gets you motivated and fired up about getting out there and attending those games and giving those kids 110% every day?
Yeah, I think it's individual for everybody. I think everybody has their own kind of personal why. But our team why, like what our department exists for, is making sure that kids are safe, and that they're able to play and practice, one, in a safe environment, but two, that they're able to practice at the highest level that they can, and try to achieve the goals and the dreams that they have. I would say that's probably our team's why.
Oh man, that's awesome. That's so cool. Well, Cody, I want to thank you for taking time out of your very busy schedule to come and chat with us. I know that all the people at home are really going to appreciate this interview and everything that you've done. And I want to make sure I thank you on behalf of everybody at home for helping to make the children of Arkansas better today and healthier tomorrow. Thank you guys so much for tuning into this podcast. If you found this very informational or helpful, please make sure that you like, share, and drop a comment. Until next time, you guys stay encouraged.